Hi, I'm Margaret Keast and I'm studying psychology at the University of New England, and today I'm talking about applying behaviour modification principles to help someone overcome a fear or phobia. In particular, I'm going to discuss talking about overcoming a fear of escalators today. But first of all, let's talk about what is a phobia. A phobia is an intense fear to a trigger or stimulus that causes overwhelming anxiety and disruption to their everyday life. So they may have panic attacks, they may feel loss of control, they may feel the need to defecate or urinate. One of the most effective therapies for phobias is exposure therapy or in vivo desensitization. And this is a gradual exposure to the object of their fear, and in this case it's an escalator. So we use a slow approach. We monitor the person's reaction to this, and we use this by measuring their anxiety. So we'll use a scale from 0 to 10, 0 to 100, and we'll ask the person, and we'll ask their feedback, how did they feel with each exposure, so we can monitor them and we know whether they're ready to take that next step or whether to push them just that little bit to go that next step. So first of all, let's call our friend with the phobia Joe. So what we might do in our first session is we've gone through the hierarchy of fears. We know what Joe's worst fear is, and we know what his least fear is with regard to escalators. And that might range from 90 to 60. And 60 is, it's relatively high, but it's not super high. And then we will talk to Joe about our next step. And our next step could be we're going to show Joe some still photos of escalators. And these might be on the computer, they could be photographs that we have on to hand. So we're going to ask him how he feels about that. And he may have some anxiety towards that, he may have none. So we'll show these photos to Joe and we'll ask him then to rate what is his distress level with regard to these photos. And it might only be 20. And that's great, because that means that we can progress a little bit further. So we'll ask Joe then, can we show him some moving escalators, a video? So Joe says yes, so we'll go ahead and do that. And he's watching the video and it's not producing too much anxiety for him, hopefully. And he may feel, again, 25, 30. We're watching the video of the escalators. And again, we're monitoring him. And we'll ask Joe, what do you think our next step should be? Should we go and actually see an escalator? So that means that we've got to go out and we've got to actually confront in person that stimulus, which is the escalator. So let's say we're going to go to a shopping centre. So off we go with Joe, and he may have some apprehension about this. So we'll might sit with Joe for a little while in the car park and talk to him about how he feels. We might get a distress rating, and he could be up around 75 now. So we'll talk to him and we'll sit there for as long as he needs to feel that he can then step out of the car and go and confront an escalator in real life. So we might sit there for a little while, and then Joe says, okay, I feel ready now. So we'll take that step out and we'll go to the escalator. And what I might suggest is that we actually confront an escalator side on. So we're not actually looking at the escalator going down or going up, but we're looking at it to the side. So all we can see is the people going up and down. So we'll sit there and we'll ask Joe, how does he feel about this? And we might be standing 10 metres away, and his stress level may actually be lower than what it was when he was in the car. But we're watching people going up and down the escalator, and I'm talking to Joe and asking him how he feels, and he's feeling pretty good about it. Considered. He's got sweaty hands and sweaty feet. His heart is starting to, it's going pretty fast. But he can converse with me, he can talk to me, he's coherent, he knows what he's doing. He's not having a major panic attack. He's not feeling out of control. In the opposite is, he actually feels in control because he's the one who's telling me that we can go forward. Let's discuss how much physical support you want on the escalator. Do you want me to stand close? Do you want to hold hands? Do you want me to hold your arm? What is going to give him the most physical comfort going up the escalator? So we might take a few more steps, and we might get close enough now that maybe we're only 2 meters away. And Joe says, okay, let's give it a go. Let's go. This is what we want. Joe is now feeling empowered enough that he wants to actually confront his phobia and get on an escalator and go up. The escalator, we're riding up, and you can feel the stress in Joe. His body starts to become quite rigid and tense. He stops talking. And what do we do when we're getting off the escalator? We get him moving. We move away. We give him time to come down, and we ask him, how did that feel? What was your scale of distress on that escalator? And he might say it's 95, which is pretty high, but you know, he's able to talk. He's able to move. He's not having a panic attack. He's not screaming. He's not having a meltdown. This is what we want. You know, it's not ideal, but he's able to be a person who is with me. He's not in his own little world having a panic attack. So we'll sit there for a while and we'll let Joe come down a little bit from where he's feeling, and might suggest, okay, let's do it again. So off we go. We'll catch the lift down, or the stairs, back down, and we'll have another go at riding up. And again, I'll ask Joe what his distress level is. So, and hopefully each time, first time 95, second time 90, maybe the next time it comes down to 80. So we might be doing 6, 7, 8, maybe 10 exposures where I'm standing next to Joe holding him pretty tight, and we're going up. And we get to 10 and his rating has now dropped down to 60. And I'll say, well, maybe now, 60, 50, I can stand a little bit further away. So I might try that, easing out myself from being close to him. And again, we might do several repetitions, again asking him each time, what is your distress level? And hopefully, again, it's coming down, it's coming down, coming down. And we might get to a stage where I can stand on the other side of the same step as Joe, and his distress level is now around 50. So what's our next step? I stand on the step below, behind Joe. And again, we do several repetitions, until Joe feels comfortable with that level. And progressively, I will drop a step back, and a step back, a step back, step back. Now, this may not happen in one session. It may take several sessions until Joe is comfortable with me riding several steps back behind him, going up an escalator. Hopefully, in time, his fear will reduce to a point where he is comfortable riding an escalator up while I stay downstairs. And in time, hopefully, Joe will be able to we will repeat all of this with Joe going down an escalator. And again, we would start at the same approach as we did going up the escalator. I would be standing close to Joe, giving him physical support and verbal support the whole time, lots of reinforcement that he's doing the right thing, going down. And this gradual exposure will give Joe the confidence that he can face this fear. He can overcome the phobia of escalators, and he can go out and enjoy life. He doesn't have to avoid escalators when he goes to a shopping centre. He can go out by himself. He doesn't need support from anyone else when he's in a shopping centre. He can go to an airport and ride up and down the escalators. He can go to a train station. He can participate in life and enjoy it.